Pilipinas.
The path to recovery of people with disabilities and addiction can be daunting, especially when they face them alone. But thanks to rehabilitation services, we're helping them step by step go back to their healthier state. This month, we are celebrating the National Disability Prevention and Rehabilitation Week. And apart from physical therapy, we will discuss other methods for rehabilitation for both mental health as well as substance issues. I'm Dr. Freddy Gomez, and this is Medtalk Healthtalk on CNN Philippines. Our first guest is here today to tell us more about the physical part of rehabilitation. With us is Dr. Rodolfo Estrellado Jr. He's a rehabilitation medicine specialist from the Asian Hospital and Medical Center and the Philippine Academy of Rehabilitation Medicine. The World Health Organization defines rehabilitation as a way for the person to optimize their function, to regain back their function and their interaction with the environment. Let's talk about the main function of rehabilitation, whether it be maybe after an injury, after a sickness for that matter. What is the main goal why someone would go into physical rehabilitation?
It's not just after a patient actually feels something, goes before that. It's also preventive in terms of treating these patients. But our main goal in essence is achieving maximum function or in general to improve their quality of life.
For those who are familiar with stroke, someone who has survived a stroke, more often than not will have some residual effects. Mahina yung ibang parte ng katawan nila. Let's talk about that with someone who has suffered a stroke. How effective is it in bringing back that quality of life, that ability to function every day?
More commonly, people we see are people with yung tinatawag na hemiplegia or one side of their body is weak. So our focus here is to get as much function back through maybe physical therapy, through occupational therapy. We try to help them move about more, try to return their hand function if we can, and even try to achieve as close to normal as they are able to get after the stroke.
It's very important that you talk to your medical specialist to get the proper diagnosis so your treatment can be tailor-fit for you. Pag-usapan naman natin some things that our viewers might not typically think of, and that is work-related injuries. One of the most common ones, low back pain. Marami sa ating mga viewers, I'm sure hindi sila magpapatingin sa low back pain until hindi na nila kayang gawin ito. But how effective is physical therapy or whatnot in order for them to regain their functionality, their efficiency back at work?
We've noticed, especially during the pandemic, is that a lot of people started having low back pain, maybe because work from home, no, lagi nakaupo. I think the most important thing to do first is to actually identify the cause of their back pain. And more commonly, what we see for patients who are experiencing low back pain, it's a mechanical cause, no, or muscle spasm because of their typical work environment. Lagi nakaupo, for example, lack of exercise. The treatment would range between giving medication, no, to ease the pain, relax the muscle, up to strengthening yung core muscles nila to prevent the back pain from recurring again.
Is this the same as yung madalas na gawin, papamasahe ko lang yung low back pain ko, okay na to? Is what is done in rehabilitation therapy much different from just a simple masahe?
That is a common misconception that physical therapy is all masahe lamang, no? Yes, massage or masahe is part of the arsenal that our physical therapists have to treat and manage this back pain. But that is not all that is important when it comes to treating these patients. No? I personally greatly emphasize that exercise is much better in treating these low back pain patients than just plain masahe. Ang dami kasi talaga parang masahe lang. Yeah, you're correct, no? Parang masahe lang, mawawala na to. But that will not prevent the back pain from recurring. in the
Okay,
long
now let's go to another end of rehabilitation medicine, and that is the loss of a limb for either through trauma or through other medical conditions. What is the goal in trying to regain that functionality again with the use of a prosthesis?
The goal in terms of prosthetic fitting can be widely ranging, no? So for some, it would also depend on how they got yung amputation. So majority of patients in the Philippines, I think, have are underwent amputation because of a diabetic foot. Because this patient is diabetic, they would have different concomitant diseases. Some would have problems with the heart, where sensation. So it would range from treating them using prosthetics to help them walk, no, yun yung maximal range. Some patients can even join sporting events with the use of a prosthesis. And at the other end of the spectrum, some patients can use the prosthesis merely as a cosmetic, or only for cosmetic use.
Thank you very much, Dr. Rodolfo Estrelado Jr. for being with us today and sharing your insights with our viewers. Next, we'll talk about rehabilitating your mental health. This is Medtalk Health Talk. We'll be right back.
SMC, San Miguel Corporation. Bisag unsang industriya ang sugdan niini, tinguha sa SMC ang pag-uswag o paglambo sa mga Pilipino. Karon, gikan sa SMC, aniya na ang SMC Davao Cement. SMC Davao Cement. Gama sa Davao para sa Mindanao. SMC Davao Cement. Ato ni Bay.
Ito ang RPN, Radio Philippines Network, DXKT 1071 sa inyong mga radyo, ang Radyo Ronda sa Davao.
I'm Dr. Freddy Gomez, and welcome back to Medtalk Health Talk, where caring is our calling. Now, earlier on the show, we discussed rehabilitation for the body. Now, let's discuss rehabilitation for our mental health. Our guests are here today to tell us more about that. We have Dr. Joan May Perez Rifarial. She's a psychiatrist from the Veterans Memorial and Medical Center, as well as a fellow of the Philippine Psychiatric Association. We're also joined by Dr. Joyce Ann Maglake. She's a psychiatrist from the Medical City and a member of the Group for Addiction Psychiatrists here in the Philippines. Now, when we talk about mental health rehabilitation, sometimes this is not really that familiar with a lot of people, but let's talk about the importance now of mental health and its rehabilitation, especially with events such as post-traumatic stress, probably from abuse. Let's talk about that first.
This involves helping individuals who are going through traumatic experiences or other mental health conditions. It's a holistic approach. It's a process of helping these patients bring back or go back to their optimum level of functionality, optimum health, well-being, and being able to reintegrate back into the society.
And unfortunately, there's a stigma that is really prevalent here in the Philippines. Hindi pa ganun ka-open or ganun ka-bukas ang mga tao to talk to a specialist pag merong problema sila when it comes to the way they think, the feelings that they have. What are some of the obvious red flags na kailangan ng kumausap ang isang tao ng mental health specialist, ng psychiatrist?
One of the red flags is persistence of symptoms like having depressed mood, lack of self-care, inability to function well in the community, in the roles nila, no? Be it in the office, in the workplace, in their roles as parents, for example, or in their roles in the academe. So there is a persistence of symptoms. Usually we give it a time frame of 2 weeks na bagsak ang mood, the inability to function, to do the things or tasks that they need to do. Number 2, there is that functional decline already, functional impairment, decline in performance in their tasks, in their roles, in their required ability or the fulfillment of their roles in the workplace, in their roles in the society or community. And lastly, when they began to entertain negative forms of coping, unhealthy forms of coping, like entertaining negative thoughts about themselves, engaging in negative behaviors or unhealthy coping habits. These are the 3 red flags that we need to watch out for.
Joan, you mentioned earlier a holistic approach when it comes to treating someone with this. An example we gave earlier was post-traumatic stress. When it comes to the holistic approach, anong pinag-uusapan natin dito?
Biologically, we look at it from the perspective of maybe those at risk for developing symptoms of PTSD can have some genetic component to it. But we are not saying that for those naman who would have a family history of PTSD would develop PTSD later on. It's not naman like that. So there can be the genetic component and hormonal imbalance in the brain, specifically serotonin, which is the neurotransmitter responsible for the development of symptoms of PTSD. Psychologically, we look at the coping strategies, coping skills of the individual who goes through a traumatic experience. Socially, we look at the availability of social support available for the person. Experiences a traumatic event, never goes through this situation on his or her own. Mas maganda, social support is there, and through the help of loved ones, family. Lastly, spirituality also. It's about finding the purpose and meaning of what is happening, of what happened. And maybe from there, we can reflect, we can do meditation, and from there, grow from the situation.
For those with chronic mental illnesses, what is the benefit of this naman, Dr. Joyce?
Substance abuse is also one of those, and others. Rehabilitation offers a structure. The social aspect is very important because sometimes we can't control triggers. Usually when we put them in a safe environment, we ensure that there are no triggers there. And at the same time, we're working on the personal level, enhancing their coping mechanisms.
Can you tell our viewers what's a good first step? Who should they call? Who should they approach? So that they can at least get the proper referral to a mental health specialist?
In the workplaces, I think HR personnels are trained also to monitor and maybe know some of the warning signs and symptoms of a possible mental health concern. They can also go to or call hotlines. There are several helplines available, which are open 24 hours a day, 7 days a week, and they may call and ask help from psychologists and psychiatry. What's important is that they remember that help is always available, and we collaborate. We always work as a team together with the family or with the loved ones or the company where the person is working at.
When we return, we'll talk about rehabilitation for people struggling with substance issues. This is Medtalk, Healthtalk. We'll be right back.
SMC, San Miguel Corporation. Bisag unsang industriya ang sudlan niini, tinguha sa SMC ang pag-uswag o paglambo sa mga Pilipino. Karon, gikan sa SMC, aniya na ang SMC Davao Cement. SMC Davao Cement. Gama sa Davao, para sa Mindanao. SMC Davao Cement. Ato ni Bay.
Ito ang RBN, Radio Philippines Network, DXKT 1071 sa inyong mga radyo, ang Radyo Ronda sa Davao.
I'm Dr. Freddy Gomez, and this is Medtalk Health Talk. The World Health Organization and United Nations Office on Drugs and Crime say that there is around 35 million people who suffer from substance use disorders worldwide. However, only 1 in 6 people who are eligible for drug-dependent treatment have access to treatment programs. Here in the Philippines, an estimated 1.7 million Filipinos were taking dangerous drugs in 2019. And in the same year, there were only 5,277 recorded admissions inpatient and outpatient facilities, excluding those who are accessing services through community-based programs. Dr. Joyce, when it comes to substance abuse, let's talk about some of the more common ones here in the Philippines. Drugs, of course, as well as alcohol. A lot of people say that they're taking any of these substances in recreational capacity. They're totally in control with themselves. But what are some of the red flags that you already need help?
We have to be aware of the fact that usually people who are already deep in their addiction would have difficulty admitting or seeing that there's already a functional decline. So for family members, it's usually you guys who would be the first ones to notice this. So for example, if there's a very significant shift from baseline, so maybe before they used to be very punctual in work, they are very responsible, and then you start to notice that they have increased absences, they're always going home late, and then you notice withdrawal symptoms such as mood changes, some physiological changes when they don't have the substance, increased time spent to actually get those substances. So for example, in the pandemic, there are a lot of people who would risk getting COVID just to get their hands on those substances, even alcohol. So all of these things, functional impairment is really the red flag, I think, that is very apparent for even family members to notice.
Now, Dr. Joyce, is this the best way to approach a person who has that problem through an intervention, which is very confrontational, to say the least?
Yes, so usually if it is quite confrontational, it makes the person become more defensive. But a family intervention is actually a good way to sort of put it all out on the table. But my recommendation is to actually consult first with either an addiction counselor or a psychiatrist, because oftentimes we can do this together. So we use language that isn't as confrontational, or we use a method that would enable them to really see these red flags. That is, if the patient or if the person who's using the substance doesn't have any comorbid psychiatric conditions. Otherwise, for example, if they're already harming themselves, or sometimes we do see psychosis, there's no intervention anymore. They have to be brought to the ER.
So let's talk about the rehabilitation process itself. A specialized center is ideal for this kind of situations. What is the goal in rehabilitation centers, Joyce?
Sobriety. Lifestyle of sobriety. So this is like what Dr. Joan mentioned for mental health in general. It's the same thing for substance and functional addictions. Biological, so you address any biological effect of the substance. Psychological, what triggers the individual or what perpetuates their use. And social, what social factors actually promote the use of the substance. And then the last goal of rehabilitation is actually reintegration. So we reintegrate them back to society, back to their community. Otherwise, if we're unable to do that step, they may be at risk again for maybe developing another mental health problem and then using the substances again.
Someone who has gone through the rehabilitation program, the rehabilitation center, are they completely cured? If not, what are some of the reasons why someone would go into relapse?
Sometimes, because of social cues from the environment, like the presence of people who may be also engaging in those types of the substances, cues from the family, or there can be some enablers in the family as well. So these are some of the reasons for relapse. And very importantly, what's really important is to look into possible underlying mental health concerns which may co-occur with the substance use problem. Because we know that when we are not able to treat the underlying mental health concerns like depression, anxiety as the reason for a person to engage or to use substances. But there's a message like using substances or alcohol to numb our emotions because someone goes through depression. So we need to address those underlying mental health concerns which may lead someone to engage in substance use.
Now, Dr. Joyce, could you share with our viewers that notion or that saying of one day at a time? How does this method work?
Oftentimes, when we talk about our rehabilitation, it's really part of our knowledge there is to recognize that it is what we call a chronically relapsing disorder. So sometimes when we focus so much on thinking that, oh, I won't get tempted anymore, or oh, everything is okay, I'm already cured about it. The temptations would come because you're not as mindful or as aware or present of your environment. So that's actually the concept of staying present, staying attuned with your environment each day, and living sobriety is really an embodiment in the moment. So that's why we take it one day at a time. So if you notice in media, for example, in movies, in Alcoholics Anonymous or Narcotics Anonymous, people would always say the number of years that they've been sober rather than saying, oh, I'm completely cured, because it's really a lifestyle thing. So we have to maintain it each day, every day of our lives.
Thank you very much, Dr. Joyce Ann and Maglake and Dr. Joan May Perez Refarial for being with us today and sharing your tips and expertise, especially about mental rehabilitation. I'm Dr. Freddy Gomez, and we'll see you again next time here on Medtalk, Health Talk.
Ito ang RBN, Radio Philippines Network, DXKT 1071 sa inyong mga radyo, ang Radyo Ronda sa Davao.